Hi, my name is Franciele. I am a PhD student in epidemiology in Brazil, where I have been working as a researcher at the International Center for Equity in Health. Today, I'm going to present a paper evaluating the effects of a Brazilian public policy on contraceptive use and adolescent maternity rate. In 1994, Brazilian government has launched the Family Health Strategy, aiming to provide universal access to primary health care through community health workers. So it was an attempt to complement the SUS in order to achieve the even more vulnerable population. And adolescents are commonly referred as a harder to reach group in relation to sexual and reproductive health, given their spatial demands and cultural norms. Brazil has one of the highest adolescent maternity rate in Latin America, being it 63 births per 1,000 women aged 15 to 19. So our aim was to evaluate the effects of a general policy on reproductive health among adolescents. We evaluated it at both individual and municipality levels. Effects of the program on contraception were estimated at individual level using data from a public available national health survey carried out in 2013 and applying propensity score matching combined with the complex survey weights. So we applied a combination of propensity score methods and survey weighting to achieve the less biased results possible given the methods we currently have. So in the first stage, we used a probability model to estimate the probability of receiving the FHS. And in the second, after the match, we used propensity score weighting to estimate the effect of FHS on contraceptive use according to each type of method and considering the concomitant use of the pill and male condom. At municipality level, we estimated effects of FHS position over time on adolescent maternity rates using difference in difference strategy in a panel data collected by the Brazilian Ministry of Health over a period of 20 years in all municipalities where this strategy is present. We included fixed effects according to time, municipality, and state levels, and municipality-specific linear time trends, which control any long-run potential linear trend differences over characteristics across regions. The regressions were also weighted by population group. We have a panel data up to 8 years before the implementation of the program and with the 20 years of implementation. Our empirical specification to capture the pre and post timing of FHS adoption was described in this slide. At the individual level, FHS has positive effects on the use of contraceptive methods in households with teenagers. The highest effect was over the concomitant use of contraceptive pills and male condoms, an increase of 12 percentage points, while use of only male condom or only contraceptive pills increased 10 and 4 percentage points respectively. The effect was even higher among households with only female adolescents, with an increase of 26 percentage points on the use of both male condom and contraceptive pills. At municipality levels, we found robust reductions in adolescent maternity rate with the implementation of the program. These figures show a clear decline upon the program intervention. So the effects start with 3 years of program, which a decline of approximately 4%, which 2 years of implementation. In the second figure, we can see that the effect was even higher for the regions Northwest and North, which are the poorest regions in the country. So our findings show that the family health strategy affects reproductive health. It was observed not once, but twice in different methods and data sets, which shows that the program has a negative impact on teenage pregnancy throughout its implementation, and this is due to the increased use of contraceptive methods, especially in households with female teenagers. We also find that the effect was higher in the poorest regions, reinforcing the importance of this type of intervention to reach the more vulnerable population living in cities with low coverage. I want to say thanks to my co-authors, Rafael Farfich and Gabriel Verber Costa, and thank you all for your attention. Please contact me through this email for further discussion.